The heart. Although popular culture has it associated with love and our emotions, it's actually a pump that circulates our blood, providing the various parts of our body with the oxygen it needs to stay alive. The right ventricle pumps blood into our lungs through the pulmonary circuit, where it's oxygenated, while the left ventricle supplies all body tissues through the systemic circuit. Despite the chambers of the heart being filled with blood, the walls of the heart, or myocardium, are too thick for diffusion to provide adequate nutrients. Remember that your heart is beating around 100,000 times a day, so it's essential the heart has a good supply of oxygenated blood to keep our cardiac muscle cells alive. The heart makes up around 0.5% of our body weight, but needs around 5% of the body's blood supply. Thus, the heart has a network of arteries and veins that comprise our coronary circulation. Arising from the aortic root are the right and left coronary arteries. These arteries then divide into a number of branches. It's worth noting that several coronary arteries have more than one name. For example, from the right coronary artery arises the right marginal artery, also known as the acute marginal artery. Also branching from the right marginal artery is the posterior descending artery, known also as the posterior interventricular artery, because it runs along the interventricular septum. However, different people have different configurations of their coronary arteries. While in most humans the posterior descending artery comes from the right coronary artery, in some people it's connected to the left coronary artery, and on rare occasions it arises from both the left and right. Arteries arising from the left coronary artery include the left anterior descending artery or anterior interventricular artery, the left circumflex artery, and the left marginal artery, also known as the obtuse marginal artery. This network of arteries divide further into atrioles and capillaries that nourish the myocardium, with blood being returned to the heart via cardiac veins which join to form the coronary sinus, which empties into the heart's right atrium, ready for a return journey to the lungs. Interestingly, while it's during systole, when the ventricles are contracting, the blood is provided through the pulmonary and systemic circuits, blood is actually delivered to the myocardium during diastole, when the heart is relaxed. The reason being that when the ventricles are contracting, the coronary arteries are compressed, which makes it difficult for blood to flow through them. Indeed, during systole, the aortic valve is open and the atomosis between the aorta and the left and right coronary arteries are covered by the cusps of the aortic valve. When diastole occurs, the aortic valve closes, allowing diastolic pressure within the aorta to supply blood to the coronary arteries. Coronary arteries are considered functional terminal arteries, or end arteries. This means that each artery supplies a particular area of the myocardium. There is very little anastomosis or overlap between the various arteries and the tissue they supply. One consequence of them being end arteries is that if an occlusion or blockage occurs in a coronary artery, the impacted tissue does not have an alternative source of blood supply and can become ischemic. Indeed, the leading cause of death in Australia is ischemic heart disease, which is usually caused by what's known as atherosclerosis. Atherosclerosis is a plaque buildup inside the coronary arteries, which obstructs the flow of blood. It's a complex inflammatory process, often starting in childhood and gradually developing over a period of decades. It can begin with irritants such as hypertension or toxins and low-density lipoproteins or LDLs that deliver cholesterol to cells via the bloodstream. These irritants damage the endothelium of the blood vessel's tunica intima, allowing the LDL cholesterol to attach to the endothelium, build up and oxidize. In response, the immune system's macrophages ingest the cholesterol but can gorge themselves and then die, forming what's known as foam cells, which build up to form a fatty streak. What's more, smooth muscle cells deposit calcium into the plaque, which has the effect of hardening it, hence the name atherosclerosis, which means hardening of the arteries. The smooth muscle cell can also excrete collagen and elastin that forms a fibrous cap over the fatty plaque, which can rupture, exposing the material inside the plaque to the blood. This material is thrombogenic, meaning it's prone to forming blood clots that can cause an occlusion in the blood vessel, starving that section of the heart of oxygen. If not quickly remedied, can result in a myocardial infarction, commonly known as a heart attack. Given the high impact of coronary artery disease on the Australian population, many of those engaged in nursing practice are directly involved with the diagnosis and treatment of patients with atherosclerosis.